life taught me is to be persistent.
You had a very long path to get to where you are now.
I was not accepted in any of the medical schools.
So much rejection and you kept going.
When the operations do take long, there is a strength that comes from somewhere, and maybe God just gives people the strength. You need to go beyond your interests to get things right, to protect your patient. Then it's euphoria.
I'm Elena Reddy and welcome to Foreign Influence. We have a very special guest today, Dr. Sergey Mintnovetsky, who is a cardiothoracic surgeon. Sergey, thank you so much for being a part of our show.
Good afternoon, thank you very much.
Please tell me where you were born and what do you remember about your childhood?
I was born in Ukraine, in Kiev, the capital of it, a big and lovely city. My childhood was a happy one. Happiness of my childhood probably comes from the family. I'm very happy with my parents. They both engineers. Despite of working hard and not making much money, they try to make our childhood as good as it could be. Myself and my brother.
At that time it was Soviet Union.
Soviet Union, that's exactly right.
Did you speak Russian or did you speak Ukrainian language?
We've got a mixed family where my mother is from a very Ukrainian family and the father is from Russian-speaking family. The language at home was Russian.
You had a very long path to get to where you are now. Tell us about it.
It was a long path, and what life taught me is to be persistent. In Kiev I finished the 8-year school, and after 8 years of basic education I went to the so-called medical college, which pretty much was an equivalent diploma in nursing. Within these 3 years we finished whatever high school requirements were, as well as the nursing education. It was pretty intense and very good course. I finished with the honors at medical college. In '88 I managed to get a place at the Ukrainian State Medical University. Then I have not finished medical school, even I was progressing quite well, I believe. My parents immigrated to Australia in 1992.
How did you react to that? Were you excited? What were your emotions?
It was something different, unknown. The reason for immigration of my parents was to get to better and safer life.
Yeah.
And obviously they were thinking about the future of us, myself and my brother. The first person who came to Australia was the youngest brother of my father, and it happened in 1979 or 80, so there was a person here who could tell us what Australia is and who in fact facilitated and made it possible for us to come, and I'm very grateful to him for it. Then my parents went to Australia. I could not immigrate with them at that time. They went together with my youngest brother in '92.
That was after the collapse of the Soviet Union.
Yes, hard time, bad time for our country. And as you know, racket and lack of power and problems and issues.
It was almost an anarchy for a while there.
That's right, Alina. It was hard time. No one could predict the future. So the plan was to come as a medical student with the view of getting back to medical school and to finish the Australian degree. And I have arrived to Australia on the 10th of January 1994, almost exactly 28 years ago. 6 years time, on the 10th of January, that was the first day of mine starting working as a doctor.
Incredible.
So it took 6 years, really. I came
6 years in the Ukraine and 6 years upon your arrival.
I was studying English on English courses, and through the whole educational system in school, at medical college, at medical university, and I thought that with the level of English which I possessed at that time, I will be the king of Australia. But while I was in the plane, and when the Australian waiter came and asked tea or coffee, I could not understand the word that she said. So
that's okay. I was in your shoes. I know how that feels.
When I arrived, and I remember that my first impressions of Australia, I looked around such a sunny, beautiful country. Probably the area we lived in, Bondi Beach area, beautiful area. And then I came there and then realized that the reality of life are such that if you do want to achieve something, you've got to work for it and to work hard for it. Therefore, my first job, in addition to my 2 English courses, was washing plates in a Russian restaurant.
You were the dishwasher.
I was. Other job after that was I started working as a nursing assistant. And the other job that I've had, it was at St. Vincent's Hospital in sterilization departments. And when the instruments from operating theaters were coming, covered with blood or cartilages or whatever that was, my job was to wash them, to clean them. And in my
So you
mind,
were still in the industry, you could say?
Yes, and I was thinking and dreaming of actually using these instruments in the future. So yes, 2 jobs, 2 English courses, and that's how I lived for about a year. At that time there were 11 medical schools in Australia. The only medical school that gave me an opportunity to come to the interview was Tasmanian Medical School. I remember that interview, I came there not understanding how serious that all was. I flew from Sydney to Tasmania, and I came in my jeans.
Casual clothes.
Casual,
just to have a chat to somebody.
That's right. And at that time, and there was a dean of medical school, and there were
Very
interview
official,
of couple more people. I barely could speak English really, and for whatever reason, I just thought that people will just embrace me and will take me, no matter how I look and what I do. But that was not the case. I was not accepted in any of the medical schools in the first year of my life in Australia. But at one of the universities at UTS, for whatever reason, I put the application for a nursing. And nursing course at UTS, at University of Technology in Sydney, has accepted me. So at the end of this year, that's my second year of life in Australia, I applied again to all 11 medical schools. Whoever will listen to me going towards the science degree and then to get to medicine is the better path. All 11 medical schools have looked at my paperwork and my achievements, and 10 of them again were not interested in me, and the Tasmanian Medical School invited me for interview again. And I did come.
Did you prepare? Yeah.
Yes,
did you buy a suit? Yes. Polish the shoes?
Yes, I bought the appropriate
attire.
Outfit. I'm sure that my effort was better, but I wasn't offered the place there again. At that year, the only other course that I applied...
Rejected. That must have been so hard. So much rejection, and you kept going.
I kept going. I remember that...
That's admirable.
The sofa bed and table and all of these applications, paperwork, 11 piles of the stuff.
That's hard. That's tough.
I wanted to get back to medicine. The only other course that I applied, a part of medicine, was science. It was biomedical science at UTS. That was my third year of life in Australia, studying biomedical science and continuing to do some other work, Pizza Hut delivery and cash out operator and whatever that I could do to support my
life was
family.
Tough.
Yes. My wife and my oldest son.
When did you get married?
I knew my wife to be for a number of years back in Ukraine, and we had our first boy there, but I came to Australia on my own, and then they rejoined me. My wife through all of this time was very supportive of me, and in a way, she gave me a chance to study while she was working in the tourism industry. And then when I finished my studies and started working as an intern, then she did her studies and then she got to university. So I finished biomedical science degree well. I get good marks. Almost all of them were distinctions and one high distinction.
Incredible.
And I applied again to all of, well known to me, 11 medical schools.
Third year in a row.
Tasmanian Medical School invites me for the third time, and I just started losing the hope. And then she picked the line. She said, "Sergey, you've got the spot at medical school."
Congratulations! So, at what point did you decide that you wanted to specialize in surgery?
Probably during my internship year. I think the environment and the people who I worked with, and the difference that various specialties make in people's life made me to think that the surgery is something that is more relevant to me.
And why did you choose to be a cardiothoracic surgeon?
Through my training and interests, I was attracted to two specialties of surgery: plastic surgery, and I've spent 3 months as a resident during the basic surgical training on the cardiothoracic unit. Two different specialties, different requirements, different lifestyles, and interestingly enough, both of them attracted me. And I could not make a choice, and then I spoke with my wife, and she said, "Well, listen, you just need to, someone needs to make a choice for you, or you need to get a sign from above." And I said, "I don't know how to read the signs." And she said, "Well, listen, why don't you on piece of paper write cardiothoracic surgery, and another piece of paper you write plastic surgery, and give it to our youngest child, and whatever they pull out of
like
the hat."
Like a lottery.
Like a lottery. Then to take this piece of paper, I opened my drawer in my table, and I took out the piece of paper, and that were just sticky pieces of paper for advertisement of one of the medications, and it still lies in my desk, and the picture that was there was heart with aorta and pulmonary artery. They were, and I took this piece of paper to write it down, and it just looked at me, so I didn't have to write anything down.
Wow. What are some of the challenges associated with conducting surgery, both physically and mentally?
Physically, with a specialty where I am in cardiothoracic surgery, some of the operations can be fairly long. You train your body in a way how to sustain operating for a number of hours. You think, or I think, what I eat day prior to surgery. I think of how much fluid I drink, because if you're stuck in a hard surgery that may take 3, 4, 5, 6, 7 hours sometimes, you may not have time to go to the toilet. I must say, when the operations do take long, there is a strength that comes from somewhere, and maybe God just gives people the strength. You just keep going because you cannot stop. And some of the parts of the operation, when we stop the heart, let's say, and lungs, and patients are on cardiopulmonary bypass, and then the time is against you. The sooner you do things, the better it is, but you need to do things of high quality. If you don't do it well, or if you do make a mistake, then you pay the price, and what's more important, the patient pays the price for things that are not done well. The important things are to organize things well, to be prepared, to have your plan A, B, and see. These decisions are easier to make with time because you get more experience and you know which things to avoid and what can be done, but it's not possible to know or predict of how things will be, particularly in complex situations, particularly with elderly, particularly with frail people. And with time you learn how important it is to make a decision to operate or not to operate. You need to be leader in operating theater and in your team, and that is important. There is a team, particularly again with the cardiac surgery, where there are a number of specialties and a number of people involved in the surgery, and with lung surgery as well, but specifically with cardiac surgery, heart surgery. You've got involvement of at least probably 7 or 8 people. It's a very specialized area.
It's a team, it's a real teamwork.
It's a team. It's a surgeon, it's the assistant, this is the anesthetist, this is the perfusionist who looks after heart-lung machine, this is the scrub nurse, this is the scout nurse, this is the anesthetic nurse, and a technician in theater. At least 8 people who are around. People have various ideas and everyone tries to help, but at the end of the day, it's your responsibility, and you need to direct the efforts in the right way, and you need to supervise every moment how technician does things to make sure that the legs or arms held up and they're not dropped accidentally, the position of the patient. You need to be on the same way with your anesthetist, and particularly in this specialty. So
the person doesn't lie flat?
For heart surgery, yes, flat, but when we do, let's say, coronary artery bypass graft surgery, we need to take the arteries from the chest or artery from the arm, so the arm is extended. Mm-hmm. When we take the veins from the legs, the people in a so-called frog position, we just make the excess such that we can get the veins. So there are certainly very important points in positioning of the patient. You need to go beyond your interests to get things right, to protect your patient, because there will be a number of various influences, and all people mean well and from different specialties, but at the end of the day you've got to have your say. The physicians, the staff in intensive care unit, the consultants, the fellows, the registrars, the nursing staff, they need to respect you. If you come and just come in and go away and just write in the notes management as per ICU, then I don't think anyone will take you seriously. And then if there is an issue or you are not happy with something and you didn't prevent it from happening, then there is no reason to blame on others. But if you came and you spend time and you look into things and to look at the patient, look at the numbers and speak with all of the involved parties and get good understanding.
So that personal time is essential with people.
Yes.
What is cardiothoracic? What does that mean?
Both of these terms come from the Latin or Greek words, and cardio is heart, and thoracic from thorax, and thorax is chest. It's a heart and lung surgery.
What is the most complex operation that you have ever performed? How many hours did it go for?
I was involved in the case where I operated 16 hours, 16, 17 hours.
16 hours?
Yes.
Could you eat during that time? Could you go to the toilet during that time?
We had one brief break. Yes, so some cases can be fairly prolonged. As an assistant during my registrar times, I was involved in one case that a surgeon did for 13 hours, and that was a second time redo, so this person had the valve surgery twice, and he did it for the third time. It was more complex, and I was involved myself and did similar operations that would take time. The other operations that may take longer time is the so-called dissection of aorta, The aorta is a big artery that comes out of the heart, and when there is a very dramatic and acute event, when the blood starts splitting the walls of this aorta, and it's
that doesn't sound good.
No, they may cause imminent death, really, or within a very short time. You go and you try to deal with this situation, and this type of operations may take a long time. Yes, I certainly...
Have you done heart transplants?
My first experience was at the Alfred Hospital when I worked as a fellow, as a young surgeon, and then I worked at Royal Children's Hospital where I was involved in transplantation of the heart on very little children. And then in Canada, in Toronto General Hospital, they had a very strong transplantation program there.
Where do you work now? Which hospitals? Please list them. If someone would like to make an appointment to see you, what would they have to do?
To contact my rooms, I've got the website. Publicly, I work in 2 hospitals, in Frankston Hospital, and you'll be surprised at the Northern Hospital, which is a bit on the distance from where I live. Both of them are great hospitals, and in both of them I do thoracic surgery or lung surgery, and I do obviously lung surgery privately. The heart surgery I do privately, and the main hospitals where I do both heart and lung surgery is Mulgrave Private Hospital, Peninsula Private Hospital, and Cabrini Hospital. So these 3 main hospitals. I do some work at Knox, and for thoracic surgery or for lung surgery I do additionally some work at Holmesglen Private Hospital in Moorabbin, and at St. John of God Hospital in Berwick, and there is another smaller hospital where I established thoracic surgery. It's the Bayes Private Hospital in Mornington. A number of hospitals.
Sounds like you're a really busy man. How many days a week do you work?
7.
7 days a week. So, and your profession, does it allow you to ever go away on holidays?
Public system, yes. The way private system works, you need to be good and you need to be available. You are personally responsible for your private patients, and if you want to go to the holiday, people still will call you, and you still need to follow them up. Even when you're in a distance, you always speak with another surgeon who would back you up. Public or private patients, they're all equal to me.
To keep up with the physical demand of being on your feet for a number of hours, so do you have to work out in the gym, or is just being there is enough on its own?
I do. I was part of powerlifting Australia, and I did powerlifting back home in Ukraine. Yeah. I was Tasmanian state champion in my bodyweight.
Unbelievable.
2 or 3 times, and I think I was 3rd in New South Wales. And my biggest achievement, I got to Australian Open. I participated once in powerlifting there.
After a surgery, especially 16-hour surgery, how do you unwind?
Depending on how the surgery went.
Okay.
If surgery didn't went well enough, or let's say if the patient is still in a hard condition, then you just live in this halo of concern. With heart and lung surgery, particularly with the heart surgery, it's not infrequently after you've done the operation, contrary to a lot of other situations or other specialties, things have not stopped. You have fixed the things, but process keeps going. Not infrequently you do not know what the final outcome will be. And then minute after minute, hour after hour, you're alert and you think and you see how patients goes, whether there is a bleeding, whether the heart is stable enough, whether there is any support for the heart and lung activity required, what the blood pressure of the patient. So things continue. And if things go well, then it's euphoria. And that's what...
you feel rewarded.
I feel
such
well.
A great outcome.
And thanks God, there are many more situations like that. If things went well, yeah, you're fine.